defeated. Her resignation was rejected.
A prostate cancer survivor says new technology has helped change his life. Medical reporter Liz Bonus shows us how.
Hey there, everybody. This is Roberto Correa. He had successful prostate cancer treatment, but now with the help of Dr. Paurush Babbar, who you see here also, he wants other men to know you can have successful treatment for a common side effect of this condition as well.
I became very incontinent. From the morning to the evening, I could go from 8 to 12 guards in one day.
Eventually, Roberto consulted Dr. Babbar, a reconstructive urologist here at Ohio's Urology Group, about the use of new technology. In Roberto's case, it literally shut off the problem.
So in the about 7 to 12% of patients who may be leaking after their prostate's removed, we can install an artificial urinary sphincter.
It's a fully internal device put in an outpatient procedure,
which has a pump in the scrotum, and then there's a cuff that sits around the urethra.
Then, as this demonstration shows,
when a patient needs to pee, he'll grab the pump that's inside his scrotum. He'll give it a couple squeezes, so squeeze, 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 and that pushes the fluid from this cuff that would be around the urethra into the pressure-regulating balloon.
Within seconds, then, the balloon pushes the fluid back into the cuff, which shuts down the mechanism that causes the incontinence. For Roberto, that's been life-changing.
As soon as he activated, it was like, I'm not leaking. It was incredible. I mean, it made me happy. It will change your life to just being normal again.
Now, if you meet this criteria, the procedure and technology covered by medical insurance plans. With your health news, I'm Liz Bonus reporting.